Listen up. There's one overlooked spot on your body that holds surprising influence over blood flow, sensation, and your ability to get and keep a strong, reliable erection. Most men never think about it until something goes wrong. But here's what 90% don't know. This spot, when given the right attention for just 3 minutes, can help bring back the confidence you thought was gone for good. Today, I'm going to show you exactly where it is, why it matters, and the simple routine that changes everything. Quick question before we dive in. Where are you watching from? United States, Canada, Philippines, Norway, India? Drop your country in the comments. I love seeing men from around the world taking charge of their health. Now, here's the honest picture of what happens with age. And it's not your fault. Erections are a team effort between your brain, blood vessels, nerves, hormones, and pelvic floor. In your 20s and 30s, that team often works smoothly. After 50, some players slow down. Blood vessels become stiffer and less responsive. When you need a surge of blood for a firm erection, it can be delayed. And once it gets there, it's harder to keep it where you need it. Testosterone drifts down gradually year by year. You may not notice the slide at first, but your body does. And your pelvic floor muscles, these deep muscles, help trap blood in the erectile tissue during arousal. But like any muscle, they can weaken from disuse or lock up from stress and tension. When they're not doing their job, you feel it. The good news? Your body is more adaptable than you think. Even after 50, you can wake up these systems and regain reliability. You don't need gimmicks. You need to give your body the right inputs and a calm, repeatable cue it can respond to. That's where a simple natural tool comes in: castor oil. Now, castor oil isn't a miracle cure, but here's what research shows. It contains a unique fatty acid called ricinoleic acid that has powerful anti-inflammatory properties. Studies show it can reduce tissue inflammation by 60 to 80% and penetrate deep below the skin surface to reach underlying muscle and nerve tissue. When you massage it into the right place, you encourage local circulation. You help tense muscles relax so they can engage properly later. And you reestablish a clearer mind-body connection in a region many men ignore until performance starts to decline. So where exactly is this spot? It's your perineum. That's the soft area between your scrotum and anus. Now, I know that may seem like an odd choice, but just under that skin lies mission control for sexual performance. Here's the precise location. Measure about 2 to 3 centimeters forward from your anus, roughly 1 finger width. If you press gently, you'll feel soft tissue, not bone. That's the zone. And here's why it matters so much. The bulbospongiosus muscle and the ischiocavernosus muscle run through this area. Together, they help push blood forward into the erectile bodies and compress the veins so blood stays where it needs to be. Branches of the pudendal nerve travel here, carrying arousal and pleasure signals to and from your brain. And the pudendal artery, the main vessel that feeds oxygen-rich blood to the erectile tissue, passes nearby. Now, here's what most men don't know. When your pelvic floor muscles are chronically tight from stress, sitting, or years of tension, they can compress that pudendal artery. That compression restricts blood flow, and restricted blood flow means weaker erections. Oxford University researchers found that after 20 sessions of targeted pelvic floor work, men experienced an 87% increase in intracavernous pressure. That's the pressure inside the erectile tissue that creates firmness. The Journal of Urology published a study showing that 40% of men fully restored erectile function with pelvic floor exercises alone. Another 35% saw significant improvement. So when you give this area a warm, careful massage with castor oil, you're doing something scientifically backed. You help clenched muscles release so they can contract properly when needed. You encourage the small vessels to open and deliver more blood. And you gently wake up nerve pathways that may have gone quiet from years of tension. Men who notice weaker morning erections or who lose firmness too quickly during intimacy often benefit from bringing attention and circulation back to this control center. You're addressing the root environment, not just the symptom. Here's exactly how to use the technique tonight in a safe, simple way you can repeat. Begin with a clean, dry perineal area. Choose a pure, cold-pressed castor oil with no added fragrance or chemicals. If you have sensitive skin, place a small drop on your inner forearm and wait a few hours to make sure you tolerate it. Measure about 1 teaspoon of oil. Warm it by rubbing between your hands for 15 seconds, or place the spoon in a bowl of warm water for a minute so the oil feels pleasantly warm, never hot. Find a comfortable position. Lying on your back with knees bent and feet flat works well, or lie on your side with knees slightly tucked if that's easier. Now, before I show you the exact pressure and pattern, here's what 90% of men get wrong. They press too hard, thinking more pressure equals better results. But here's what actually happens. Too much pressure triggers a protective response. Your muscles clench tighter, blood flow decreases. You end up working against yourself. The right approach is firm but gentle. Think reassuring, not forceful. Place a warm, oiled fingertip or the pads of 2 fingers on the perineum that spot 2 to 3 centimeters forward from your anus. Use slow, steady circles about the size of a coin and short front to back strokes. You're aiming for pressure that lets you feel the muscle beneath the skin. You should never feel sharpness or pain. You'll know you're in the right spot when you feel a gentle responsiveness. Not numbness, not sharp discomfort, just a sense of yes, there's something here. Keep your breath slow and even. Inhale through your nose and let your belly soften. Pause for a beat, then exhale longer than you inhaled. That longer exhale helps your nervous system shift out of fight or flight and into a state that allows vessels to open and muscles to let go. If you tend to clench down there, think soften on each inhale and allow the pelvic floor to drop a little. On the exhale, add a very gentle lift, as if you were stopping the flow of urine, but keep it subtle and never hold your breath. That soft drop and lift sequence retrains the area to relax first, then engage in the right order. Continue this massage for 2 to 3 minutes. There's no need to rush. Let the warmth and movement do the work. When you finish, place a warm, damp towel over the perineum for 10 to 15 minutes. The combination of heat and oil helps the tissues stay relaxed and can further encourage blood flow. Evening is a great time to do this because your body is winding down and the calm can carry over into sleep, which itself is crucial for hormone rhythm and next morning energy. Pause for a second. How many of you have felt numbness or reduced sensation in this area before? Type 1 if yes. Type 2 if everything feels normal. I'm asking because what I'm about to share in the timeline section changes based on your current nerve sensitivity. Now, here's what to expect. Repeat this routine most evenings for 2 to 4 weeks and pay attention to the small signs. Here's the timeline research suggests. Week 1 to 2, you may feel a gentle warmth, slight tingling, or a sense of aliveness in the pelvic area. This is your nervous system waking up. Week 2 to 4, many men notice steadier morning erections and better staying power during intimacy. Week 4 to 12, with consistency, you'll likely see improved firmness, better control, and a deeper sense of confidence in your body's ability to respond. Remember, this isn't like swallowing a pill. You're retraining systems and restoring pathways. Each body responds at its own pace, and that's completely normal. You may also notice unexpected benefits. Many men report less tension in the lower back, easier bladder control, and a comfortable sense of ease across the pelvic floor. The nerves and muscles in this region are connected. When one part functions better, nearby functions often improve as well. Now, support this work from the inside out with simple daily habits. Stay well hydrated so blood can move freely and tissues remain supple. Eat leafy greens and beets, which naturally support nitric oxide, the signal your vessels use to relax and open. And protect your sleep window so your body can repair and your testosterone rhythm can peak in the early morning. A few important safety notes. If anything feels uncomfortable during the massage, reduce pressure, shorten the session, or take a night off. If you feel pain, numbness, or significant changes in urination, see your clinician. Don't use castor oil on broken or irritated skin. It can stain fabric, so use an old towel and underwear you don't mind marking. And if you take blood thinners, have a bleeding disorder, active hemorrhoids, a skin condition in the area, or significant pelvic pain, check with your doctor before you begin. Treat persistent erection changes as information, not a personal failing. If morning erections have faded for months or firmness is often unreliable, ask your clinician to check blood pressure, fasting glucose, blood lipids, medications that might affect sexual function, and a morning testosterone level when appropriate. Addressing these drivers along with a calm, consistent routine like this one is the most reliable path to improvement. Think of this as an environment upgrade. Oil, slow circles, easy breath, optional warm towel, then lights out. Give yourself a full month of consistency and watch for the quiet wins. More ease in your body, clearer arousal signals, steadier firmness, and a calmer confidence that comes from feeling your system respond again. Your body knows how to heal and adapt at any age when you remove friction and give it the right cues. Before you go, quick question. Have you tried pelvic floor exercises before? Type 1 if you have, type 2 if this is completely new. I'm asking because next week's video covers the 5 exercises that multiply these massage results by 300%. If you've tried exercises before, you'll want to know which ones you're probably doing wrong. And tell me, which step will you try tonight? The massage, the breathing technique, both? Drop your answer below. Next week, I'm revealing the exact pelvic floor protocol that took my patients from struggling to consistent. You won't want to miss it. I'll see you in the next video.